Have you ever felt your heart racing, your breathing get shallow, your mind spiral, and you're unsure if you're actually in danger or just overwhelmed? You might be experiencing a panic attack or maybe potentially an anxiety attack. But today we're going to talk about the differences between the two and why they are important to do so. Now, one of the things that I hear all the time as a psychologist is people confusing anxiety attacks for panic attacks and people confusing panic attacks for anxiety attacks. Now, they are different, and here is how they are different. Typically, a panic attack is sudden. The symptoms happen within minutes. It's an intense fear, heart palpitations, sweating, trembling, chest pain, shortness of breath, dizziness, a sense of losing control, going crazy. It feels almost like a heart attack. It is classified and defined clearly in the diagnostic manual as it relates to mental health disorders. Anxiety attacks are not necessarily a formal clinical term, but it typically builds gradually. It's often linked to a specific stressor or worry. It can include muscle tension, restlessness, difficulty concentrating, rapid heartbeat, and irritability. You can think of an anxiety attack as sort of a slow burn worry. It gets bigger, it grows as the day goes on. And you can think of a panic attack as like a lightning bolt. It happens when you least expect it. You're kind of jolted by its intensity and the fear that grapples you. And it could also happen for no reason at all. Your life could be going perfectly well and you could still get a panic attack. Where typically an anxiety attack, there's something in your life that you might be worried about. Maybe it's your job, maybe it's a relationship, maybe it's your health. There's usually something underneath the surface of an anxiety attack that typically just grows over time throughout the course of the day, the week, or even the year. One of the best ways to cope with a panic attack is to ground yourself in the moment. This could be by using some form of texture, so like touching something, feeling something, anything to get yourself outside of your head, right? Going to the sink and putting cold or hot water on yourself, or anything that you can hear, like music. Anything, again, that can get you out of yourself and into your senses is probably the best way that you can ground yourself. Oftentimes, breathing meditations can also be helpful. Doing things like box breathing, where you breathe in, you inhale for 4 seconds, you hold your breath for 4 seconds, and then you slowly exhale for 4 seconds. So oftentimes breathing can be helpful, but I've heard from a number of patients that breathing isn't the most helpful, that usually actually doing something that's sensory to some component is probably the most helpful thing as it relates to a panic attack. Now, when it comes to anxiety attacks, now you live in the head. There's these negative thoughts that are coming up a lot. It's like watching a bad movie over and over and over and over again, and you keep replaying it and you can't stop replaying it. And so oftentimes what we do for patients is we say, okay, we're going to rewrite the script. We're going to have a new movie that plays out. We're going to question the thought, the negative belief system. We're going to have new thoughts, new beliefs, then promote new and healthy behaviors. This takes time. It's like working a muscle, like going to the gym. But over time, we can get more reflexively good at balancing and counteracting those negative thoughts with positive thoughts instead, and engaging in some type of healthy behavior that reinforces a lot of the positive thinking and emotions that can come with that. I hope you can understand that you are not broken, that there is hope as it relates to treatment, whether by a healthcare professional, a therapist, a psychiatrist, a psychologist, or even the connection with a friend, a family member, a loved one that cares for you deeply as well. My name is Dr. Phil Sarpon. I'm a clinical psychologist, and this channel is dedicated to all things psychology, wellness, and graduate school. If you have not already, please like and share this video, subscribe to the channel, and hopefully I will see you all in the next video.